Let's address what a chiropractic adjustment is. So to do that first, let me just tell you what it's not. It's not bones cracking. It's not a joint that becomes out of place and we're pushing it back into place. But essentially what's happening is we're restoring motion to a joint that's become restricted or hypomobile. So when we identify where the problem is coming from that's causing pain or nerve dysfunction, there's several different factors that are involved. So we have the disc that acts as the shock absorption, and then we have the joints that give motion to the spine. So when a joint becomes restricted, it gets locked down. It can create inflammation, can create trigger points, and can cause nerve irritation. So once we identify where the joints are restricted or what direction they need to be mobilized, we'll kind of apply a controlled force to gap those joints. So each one of these joints are surrounded by a joint capsule that's filled with fluids and gases. And so when we create that motion in the joint where we gap the joint, it's going to create a negative pressure that releases the gases that are inside that joint that create that pop that we hear. So there's various ways that we can do this. We can do this a little bit more aggressively by manually applying those forces with our hands, or other techniques that we can use that are a little more gentle approach if the tissue is too irritated or the patient doesn't tolerate a more of a manual adjustment. We can use a drop table, or we can also use a instrument that can oscillate the joint to create that joint motion that we want to restore. So in doing this, restoring that joint motion, it'll stimulate the nerve because there's mechanoreceptors, joint receptors, that give us the proprioception, the awareness of where those joints are, and it also can reduce nociception, which is our pain receptors. So it'll reduce the pain, restore the motion, and provide overall better mechanics to the spine.